All right, first we have the glenohumeral joint movements and planes. The first two are abduction and adduction, and both of those movements are in the frontal plane and along the sagittal axis. The next two would be flexion and then extension, and both of those are in the sagittal plane and the frontal axis. And then there are four more. Horizontal adduction is going back here, so this direction. Horizontal abduction going forward. External rotation going out, and internal rotation going in. Those four are in the transverse plane, and all four are along the vertical axis. All right, we have here my beautiful wife as our model. First, we have the shoulder girdle movements. First, we have upward rotation. Let's go turn around here, which is this movement here. This is done by the serratus anterior on the side attached to the ribs here, and then the lower trapezius in the back here. Next, we have downward rotation, which is this down movement going this way. This is done by the rhomboids in the back, and then also by the pectoralis minor in the chest. Next, we have depression, so just drop your shoulders, which is done by the pectoralis minor again, the subclavius, and the lower trapezius in the back. Next, we have elevation, good job, which is done by the upper and middle trapezius in the back here, the rhomboids, and then the levator scapulae, which is up here in the neck area. The next one is abduction, which is also considered, or it's also called protraction, which is bringing your arm across the center here, which is done by the pectoralis minor, the subclavius, and the serratus anterior. The last movement is adduction or retraction, which is bringing the arms, which is bringing the arms back this way, which is considered retraction, and that is done by the middle, lower trapezius, and the rhomboid. All right, next we've got the movements of the shoulder joint. This model here is my firstborn son, Elijah. He's very focused on a video beneath us of How to Train Your Dragon, so if he's not focused on you guys, it's because dragons are awesome. First, we have abduction, which is this movement here. And this is done by the supraspinatus, the deltoid, and the upper pectoralis major. Next, we have adduction, adding that arm to the body, which is done by the latissimus dorsi, the teres major, and the lower pectoralis major. Next, we have extension, which is going back this direction, which is done by the latissimus dorsi, the teres major, the lower pectoralis major, and the posterior deltoid. You're doing really well. Next, we've got flexion, which is going forward. This is done by the anterior deltoid, the upper pectoralis major, and the coracobrachialis. Next, we've got horizontal adduction, which is going this way. This way, wrong. Horizontal adduction going in, which is done by the pectoralis major, anterior deltoid, and the coracobrachialis. Next, we've got horizontal abduction, which is going back that way, which is done by the middle and posterior deltoid, infraspinatus, and the teres minor. Lastly, we've got the rotations. We've got internal rotation going in, which is the latissimus dorsi, the teres major, pectoralis major, and the subscapularis. The last movement, we've got external rotation, which is done by the infraspinatus and the teres minor. And those are the movements of the shoulder joint. Thanks, bud.